Hello again and welcome to PI Today. I'm your host, Dr. Nicholas Aloy. We have a very special guest for you today, something that is mainstream, but in personal injury, it's kind of not talked about. And I am joined here with Dr. Joon Choi, MD, plastic and hand surgeon. Dr. Choi, welcome to the podcast. Nice to have you.
Thank you so much for having me.
Wonderful. So, Doc, this is something interesting with our listeners, whether it's the attorneys or other doctors. We kind of want to know about your background, your specialty, and what does everybody who thinks about plastic surgeons, thinks about tummy tucks, facial, lipo, what does plastic surgery and hand have in common, and how much training went into it? Tell us about it.
Yeah, sure. It definitely took a while to finish everything because plastic surgery, a lot of people know us, plastic surgeons, by all the pretty much public images of cosmetic procedures, Botox, fillers, liposuction, facelift, and whatnot. It's definitely what we do, but that's only probably like 20% of our training. 80% or the majority of training goes to hand surgery, craniofacial surgery, where we learn how to fix facial fractures in trauma settings or syndromic kids who are born with defects in their cranium or some type of disorders that we can fix in both functional and structural. We also perform breast reconstruction after mastectomies to remove breast cancers. When people come in with the lower extremity open, like tibia fracture, and they need some coverage, they call us. So we perform flaps. When fingers get cut off, they call us to so we can reattach them under microscope. So it's just a really broad field of training that requires a long time. So after finishing med school, which took 4 years, I went into an integrated program, which luckily combines a lot of things in shorter time, but shorter time was 6 years.
Oh, wow, that's a long time. So you were telling me some before we started the podcast about your trauma training and the level two hospital you guys were at. And for the listeners out there, these hospitals get the basically the helivac, gnarly, crazy cases. So tell us about your experience over there. How long you worked there? What
Sure.
kind of trauma? I'm sure you saw a lot of facial fractures. Somebody might go through the windshield or stab wounds and stuff like that, and hand fractures or amputations. What did you see over there? And for how
Yeah,
long?
I mean, so many different things. I worked as a face and hand trauma surgeon at a level two hospital. OC Global is its current name, in Santa Ana, and it's busy with a lot of acute traumas. So remember, since I've done that for 17 years, I just recently stepped down a couple months ago. So I was pretty much doing it up until early this year. I still remember people coming in with all of their face broken, either through car accident or assault. Some things that I still remember is like a 3-year-old girl who somehow got her finger trapped in a escalator in a sports chalet, and then father crying because it took him 1 second just to look somewhere, and then just kid did that, trying to reattach the finger.
Wow.
I mean, it just goes on and on. And every 4th of July or New Year's Eve, we always get this explosive injuries where part of the hand, if not the entire hand, pretty much gets blasted off, and we have to somehow reconstruct it. So,
So for our listeners out there, when they need hands are not strictly ortho. Actually, I've have way more plastics. Not all plastics, but I would say 50-50 that I've met. They specialize in hands, and they are the best hand people, physicians out there. And this is where, whether you have fractures, dog bites, burns, these are the guys who take care of it. You were telling me about the hyperbaric chamber, and you're a physician that supervises. hyperbaric chambers?
Yes, I been working probably, yeah, almost 17, well, 16 years, affiliated with the St. Joseph Orange Hospital. They have this outpatient facility where wound care and hyperbaric treatment is delivered. And as one of the staff physician, I oversee and supervise the each dive that patient gets. We call it dive because they get pushed under a elevated pressure in this mono chamber where they breathe 100% oxygen, which really saturates their blood with all the oxygen so that they can get to everywhere they need. Even in diabetics with the poor blood circulation, this can help them heal. And also, when we are sort of plastic surgeons are sort of the end of the roads for like complex wounds. So
Oh, that's right.
yeah,
Yes.
so whatever wound that is, whether it's post-surgical or diabetic or whatnot, something gets complicated, they always kind of seek our advice in that.
And that is very important wound care. And we come across that. We have either product liability cases, gas explosions, burns, car burning. These are the doctors that you see, the doctors who do the skin grafts. So it is a field that is not that accessible to personal injury attorneys or other physicians to refer to. That's why I bring you guys the best and sort of our layer of outlying surgeons, because these guys, whether you know, I had a case, a friend of mine just did the surgery on, was a amputee, bad accident, patient was diabetic, and the wound wouldn't heal. Plastics had to get involved and hyperbaric had to get involved because it was just a nightmare. You have these morbidities with some of these patients or clients you guys have, that to make their life easier, the access they might not get in a regular top-notch hospital because the mechanism of payment, phenomenal physicians like Dr. Choi that can take care of it, which whether it's doing hand surgery, wound care, or scar revisions. We get tons of scar revisions, whether it's dogs, accident, glass, face, body. I would imagine that's some of the stuff that you definitely take care of.
Sure. Surgical, of course, but there's also many ways that scar appearance can be improved upon non-surgically, like laser, um, steroid injections, pressure, silicone. I mean, those are all, and even radiation, although it's only for special indications. But yeah, so there are definitely many, even non-surgical ways that we can help.
And what about nerve damage in the hand, docs? When it's extremely a bad, crush injury, what do you do? What do you recommend?
Right. So if it's only sensory nerve, um, the repair or reconstruction can be done even a year later or 2 years later. There really isn't any statute of limitation in this case because it's not attached to a muscle. If it's a motor nerve, 6 months later, that's out. It's can no longer be
It just atrophies.
because the muscle atrophies.
Got it.
Right. But the sensory nerve that provides sensation to the fingertips, hand, whatnot, there's still chance that something can be done even a long time out from accident. So I would still seek expert advice and
Perfect.
consultation.
And let's not forget the what we talked about before: orbital fractures, stuff that comes with traumatic brain injury. Whether it's forehead, cranial, things that needs to be stitched up or put back together. That's what Dr. Choi does. Anything else, Doc? Do you
I think
specialize
we
in?
cover a lot of things.
Wow, you're a busy man. I mean, that's special. So, Dr. Choi, where's your offices exactly?
My office is in a city of Orange in Orange County, the medical campus of St. Joseph Orange Hospital and the Children's Hospital of Orange County.
Wonderful. So, in the Orange County area or any area, because this is a subspecialty, let's remember Dr. Choi and let's get him some of your clients because he's something that we really need in the space. Dr. Choi, thank you again for coming on PI's Today's podcast. We'll see you again.
Thank you so much for having me.
Of
It's
course.
a
Thank
pleasure.
you.
Yeah.
Thanks for listening PI Today podcast, sponsored by Trauma Cash, Global Line Doctors, and TBI Analytics. You can find us on our website, www.pi2daypodcast.com. Also on Instagram, YouTube, Spotify, TikTok, and LinkedIn as PI 2-Day Podcast to watch all our episodes. See you next time.